Being a patient advisor is the very best work you can do, I think.
PFAC, so Patient Family Advisory Council, is made up of volunteers that are passionate about betterment for health for our community.
So the PFAC is a group of really dedicated people, about 16 to 20 people, who in their own communities are doing amazing work. We know our community best. We're a conglomerate of whole different personalities and whole different histories, but we all have the same goal.
So the PFAC has been working hard on collecting resources, being the group that can help navigate to the best sources, best availability that meets people's needs where they are.
The Patient Family Caregiver Advisory Council, known as the PFAC, is a group of really engaged and diverse patient advisors that come from across Guelph, Wellington County. They all bring different lived experience, including experience as patients as well as family members and caregivers, and they're able to bring that input to different projects that are happening from across the Guelph, Wellington, Ontario Health Team.
It's important to include people with lived experience and, the people who've been walking the walk.
There's been tremendous partnerships made within this work. We do have the person who brought food banks to Guelph on it, an Indigenous elder. We have someone whose money from the government is not sufficient and is really worried about whether she's going to be able to stay in the place that she's living. People who have had a rough go with our medical system.
It's really unique to have a PFAC in healthcare. It's something that's been around for a while, but more recently as Ontario Health Teams have been developing, there's just been so many more opportunities for patient, family members, and caregivers to give their expertise and their input into different projects. It's been really exciting to see it develop over the past few years, especially as our advisors become more confident and being able to use their stories in a way that is meaningful and able to advise what's going on in our healthcare system.
I think the feeling of being alone in a crisis, whatever it is, whether it's a mental health or a heart attack, whatever is the feeling of being alone, not knowing where to go, who to ask, who to trust in some cases.
Do you have enough food? Do you have a place to sleep tonight? Do you have a home? Perhaps it's our most challenged populations and people, as we can see on the streets, that we really need to do our better work with. So those with the most dire health profiles are getting the kind of multidisciplinary support and healthcare that they need. It's wonderful.
Patient advisors are involved in the development of our strategic priorities. They're involved in the development of our key performance indicators. We have patient advisors sitting at now our Integrated Care Council. Previously it was the Steering Committee and the Governance Council. So it's just really exciting to have patients, families, and caregivers actually sitting at governance structures, involved in leadership at the OHT. That's something that prior to Ontario Health Teams just really wouldn't have been happening. I can confidently say that patient voice has been integrated in so many different aspects of our work.
Our healthcare was very, very good, but we want it to be excellent and we want it to be for everyone. The goal is to make our health system the best health system it can be, to make a difference in the lives of people, their families, their caregivers, their friends. If you're interested in making the healthcare system and life generally better in Wellington and in Guelph, you should come and consider becoming a member of the PFAC.